is Julian Johnson, and today I will be presenting on the medical management and the diagnostic used in a patient with chronic kidney disease. According to Erden et al. 2014, he proposes that the medical management focuses on prevention, compensation for deterioration of the kidney function, and regeneration of kidney functional capacity. One of the first things you want to do in a patient with end-stage renal failure is you want to manage the comorbid conditions, and one of which is controlling hypertension. It is vital to control high blood pressure because the damage to the kidneys and resulting buildup of wastes in the bloodstream can raise blood pressure. In addition, chronic kidney disease increases morbidity and mortality among patients with diabetes and hypertension. 2019. The client was maintained on ACE inhibitors, an example of which is lisinopril 20 milligrams per oral once a day, and antihypertensive and calcium channel blockers. An example is amlodipine 10 milligrams per oral once a day. He was also maintained on hydralazine 10 milligrams intravenously as necessary for severe hypertension, and it was administered to Mr. W only for a systolic blood pressure of 180 millimeters of mercury or greater, and diastolic blood pressure equal to 110 millimeters of mercury or exceeding. However, it was held for a pulse less than 60 beats per minute. Secondly, fluid restriction. Restrictions below 0.8 grams per kilogram per day should be accompanied by regular and close dietary supervision to avoid real risk of malnutrition in chronic kidney disease patients. The client's medications were renally dosed, and he was on protein restriction in his diet for relief purposes relative to his kidney. Thirdly, fluid removal. Diuretic should be used to stimulate the urine output to prevent retention of water, solutes, and potential toxins in the circulation, and prompt measures to decrease their levels. The client received hemodialysis on Mondays, Wednesdays, and Fridays as a measure to eradicate excess waste and fluids from the blood. Medical management continued. Next, you want to treat the underlying causes. There are various treatments used to treat the underlying cause of the disease. For instance, antibiotics, which are used to treat strep or bacterial infection. Mr. W was diagnosed with community-acquired pneumonia. He was maintained on amantadine 100 milligrams per oral twice a day and meropenem 50 milligrams intravenously, which was used to treat the respiratory infection. Lastly, you want to treat the kidney failure. There are other alternatives that can be considered, which are renal replacement therapy, hemodialysis, or hemofiltration, particularly if volume overload exacerbates pulmonary edema or heart failure. On the 6th of the 2nd, 2020, the client had 3,000 mL of fluid while on dialysis. The only long-term plan are dialysis and transplant. The diagnostics. The diagnostic tests are used to detect your kidney function and to determine what stage kidney disease you have. Health history. The first thing you want to do is obtain a health history, one of which was obtained from his wife on the 1st of January 2020 upon admission, and it was discovered that Mr. W was diagnosed with hypertension sometime in the year 2016 and end-stage renal disease, and he was also on hemodialysis since 2017. Next is the laboratory abnormalities, one of which was the patient's bun and creatinine levels, which was 9.71, suggestive of renal damage, which may cause a reduction and reabsorption of bun. Diagnostic continued. Blood culture. On the 7th of February 2020, an aerobic blood culture was done, and also bottle anaerobic blood culture, which resulted in no growth within 7 days performed. On the 11th of the same month, February 2020, it resulted with 2 plus gram positive cocci. An imaging test was done on the 5th of February 2020, an electroencephalogram. It was discovered that there was significant electrical activity noted, suggesting a diffuse encephalopathy of metabolic degenerative vascular origin. The electrical activity may have compromised. And lastly, an ECG, which indicated sinus tachycardia. This was due to the community-acquired pneumonia. Thank you.